Hello, everyone. Thank you, Dr. Jose. Thank you very much for the introduction. Greetings from Canada. I have a request. I have a short PowerPoint presentation that I put together. Is that possible for me to share?
Yes.
Yeah, it is possible. You can do
Okay.
it from your end.
I can just do it from my end? Okay.
Yeah.
Okay.
Make ma'am co-host.
Okay. Just a moment while I get this.
Can you put it in slideshow mode so that everybody?
Yes, I'm just trying to do that, but there's
You can see your screen.
yeah. Sorry. The problem I have is that PowerPoint just give me 1 second. I'm going to stop sharing.
Yes, ma'am.
Let's see if it works this way. No, it won't. Okay. Forgive me for my technological difficulties here. All right. Yeah, it still won't do that. Okay.
Yes, ma'am. Now you can go to the slideshow mode.
Okay. How about if I do this? Is that good?
Yeah.
Because it won't. Yeah. Okay. All righty. Well, hello, everyone. I'm so excited to be here. And welcome to doctors, homeopaths, guests. And I would like to thank the forum organizers for their hard work in putting together this forum. As Dr. Joe said, my name is Lisa Decandia. I'm a practicing homeopath here in Canada, and I just wanted to say a few words and bring a Canadian perspective to homeopathy. And so my practice is here in Toronto, Ontario, Canada. I have been 20 years in practice now, and I practice at a multidisciplinary clinic called Balanced Healthcare, which includes other practitioners such as a chiropractor, massage therapists, and naturopaths. So we work together in different modalities to help our patients. I will talk about how I became a homeopath a little later, but for now I'd like to talk a little bit about homeopaths in Canada. So Canada is a very large country, and roughly with about 37 million residents in Canada to date, and the country is divided into provinces. The numbers that I'm going to be talking about were a little difficult to obtain because many homeopaths across Canada do not have to be registered. And I will talk about registration and licensing. So the numbers that I have are very rough estimates of practicing homeopaths, because there are naturopaths that will practice homeopathy, other homeopaths that are not registered. So I'm talking about those that I've been able to pull together that are registered here in Canada. The biggest number of registrants is here in Ontario, where I am, and in Quebec, with roughly over 700 registered or /licensed homeopaths. Next, we'll be out west with British Columbia with over 100 homeopaths. And then we have the provinces, Saskatchewan, Alberta, Manitoba, with close to 100 homeopaths. And then we have a few in what we call the maritime provinces out east, I could not get numbers on that. So, definitely over 1,000 that are registered in practicing homeopathy, but I suspect much more practicing that are not registered or licensed. So let me talk a little bit about what happens here in Canada, specifically in Ontario, the province where I work, in terms of registration, which may be different from countries around the world. So we have something here in Ontario and Ontario has about 14 million residents. It's one of the most inhabited provinces here in Canada. We have registered homeopaths and non-registered homeopaths. And there is the College of Homeopaths of Ontario, which was established in 2015. And it has over 600 registered members. You can call them licensed homeopaths. The college is a regulatory body for the profession. So in other words, if I want to practice homeopathy and call myself a homeopath here in Ontario, I must register with the College of Homeopaths in Ontario. So in that way, my registration shows the public that is searching for a homeopath that I have the credentials and the competencies to be a homeopath that will be able to take care of their health needs. And so this is a benefit, I think, for those homeopaths that are registered with the college. And it's a benefit for the public because the public can go on the registry here. They can see who has registered, what their qualifications are, and then are able to engage and see if that particular professional homeopath is someone that they would like to go to. So it protects the public. It promotes homeopathy. It is giving more awareness here in our province of Ontario with regards to homeopathy. Other provinces in Canada, as of yet, do not have this regulatory body. I think British Columbia is working towards that at this time. But in other provinces, if you want to practice homeopathy, call yourself a homeopath. At this time, you do not need to belong to a college of homeopaths. So I think in Ontario, we're quite lucky with that. If there are any questions while I'm speaking, please don't hesitate to ask. So how I discovered homeopathy, and I'm going to guess that many of you discovered homeopathy through your own personal journey. And that's exactly how I discovered homeopathy as well. And I tell my patients this, and I tell my students this, because I like to find out from them how they discovered homeopathy. Many, many years ago, I had chronic issues. I saw many allopaths, naturopaths, and it wasn't until someone mentioned homeopathy because none of the issues that I had were being resolved. It did take some time with homeopathy due to the chronic nature, but over time, these issues resolved, and I was very, very pleased. It wasn't until my daughter, who was about 1 year old, that's almost 29 years ago, my daughter was 1, and she suffered with chronic ear infections. At that time, I didn't know. I took her, she got antibiotics, and after a period of time, I was told, oh, she will need surgery. And at that point, I stopped and I said, no, no, no. There needs to be another way to do this. So I took her to my homeopath and I watched in amazement after one dose of pulsatilla, no more ear infections. To this date, my daughter's 29, no more ear infections. That's when I knew that I had to study homeopathy. For me, it was like a miracle. And so I did. I enrolled in the Canadian College of Homeopathy here in Toronto, and I will talk about the two colleges that are prominent here in Ontario. The college I enrolled in had a 4-year program specializing in homeopathy. And with this passion, I studied and I decided to change careers. Well, sort of change careers. So I became a homeopath 20 years ago after a successful career in teaching. And that's what I mean by almost change careers, because you'll see how I added that in. I graduated from the Canadian College of Homeopathic Medicine. I studied with André Sen at the Canadian Academy of Homeopathy in Quebec. And for the last 9 years, I have had the privilege of studying with Dr. Jose Isaac, who has brought even more depth into my studies. I'm also graduated with a master's degree in science in homeopathy from the University of Central Lancashire in the United Kingdom. I've had the opportunity to be an international lecturer at the Joint American Homeopathic Conferences. I am a registered homeopath here in Ontario with a full member classification. And I'm also a lecturer and clinical supervisor at the Canadian College of Homeopathy, where I studied for 15 years. So I've been able to, I feel so fortunate, I've been able to take my study of homeopathy, practice homeopathy, but also my skills, hopefully as a professor, and be able to deliver the message of homeopathy to the students at the Canadian College of Homeopathy. So my practice, again, this is not something, this may vary from country to city to province. I find for me, mainly women will come for homeopathic help. That's been my experience over the 20 years. So naturally, I have worked with a focus in women's health with a variety of things, endocrine disorders, thyroid imbalances, hormonal imbalances, so menstrual disorders, menstrual pain, also working with pregnant women, and also working with women who want to achieve pregnancy, so fertility issues. And the patients that I saw, first time 20 years ago as younger women, are going through some transitions. And so I have the opportunity to help with their transition into menopause. There's also for women, I deal with emotional issues, panic attacks, depression, migraines, sleep disorders. That's starting to become more and more prevalent. And I think a lot of it has to do with the world that we're currently asked to live in, is affecting so many women's sleep. So that's a big percentage of my practice. And then those women that decide to have children, I'm lucky enough to be able to help their children. So I do a fair amount of children's health. Things like eczema, asthma, allergies, be they seasonal or food allergies, behavioral issues, ADD, ADHD, autism, and then just generally immune system. I'm finding for children, they need more of a boost. Their vitality for many of them does not seem to be as strong as it was 20 years ago when I was practicing. And, this is a result of many things. So many of them are getting frequent colds or failure to thrive, muscle weakness, digestive disturbances, and so just generally building up the immune system. And then some general treatment, again, low immunity, frequent colds for people, frequent flus, allergies. We do have quite, um, I've seen quite a few people, and again, this is getting worse over the years, where they're having seasonal allergies, like it's April here in Canada. Spring is in bloom, as we say, and patients are calling with allergies. The good news with homeopathy is that, years ago, my patients would call with, wanting help for severe allergies. And over the years with homeopathic treatment, the severity or the frequency of calls from those patients has reduced. So, as I explained to my patients, over time, homeopathy not only helps with chronic issues, but also boosts up that immune system. So, you suffer from those issues less and less. Digestive problems is something that I also treat. Post allopathic side effects from medication, for example, is something that in many cases is something that I look at because there are side effects that are long lasting or post surgery, diabetes, high cholesterol, which again seems to be on the rise more than when I first started practice. So teaching for me is an extension of practicing homeopathy. And I would like to speak about that a little bit. As I mentioned, I teaching at the Canadian College of Homeopathic Medicine, and I have been doing that now for 15 years. And it's a great joy, and it's the opportunity to not only spread the word with very interested students, but to be able to bring in clinical practice examples, which really helps with the learning, helps with the education. And so it's not just pulled out of paper, it's also pulled out of experience. Subjects that I teach or have taught in the past, homeopathic philosophy, organon, materia medica, case taking, both acute and chronic case taking, case management, and a variety of therapeutic classes such as women's health, pediatrics, treating the elderly, obstetrics, endocrine disorders. I'm also a clinical supervisor, and I supervise students as they take cases, and I help them work through those cases to help their patients. I also teach something called standards and guidelines, which you see at the very bottom here. And again, here in Ontario, that's something that's required to have knowledge of in order to register with the College of Homeopaths of Ontario. And standards and guidelines simply means good case management, what to do in certain situations with patients, how to communicate with your patients, for example, how to be ethical with your patients when treating them, how to be able to manage a case as it goes along and help your patient understand what is going on in their treatment. And I think those qualities are very important for a homeopath in the patient homeopath therapeutic relationship. Patients, at least the patients here in Ontario, they they want informed consent. They want to know what's going on with their treatment. This is very, very important in homeopathy and in other health treatments, that the patient be part of the process, not separate from the process, where the homeopath is the one that's leading the process. This is my point of view. I think that this also makes for a better therapeutic relationship when a patient can understand what is going on. So I do think that I bring that into part of the conversation, definitely in my initial case taking, but along the way. And then I find that patients are very motivated to go along with the treatment and compliant and responsive, and are aware of the changes that are going on and are able to give good feedback. And when we get good feedback from our patients in the follow-ups, then that just helps our practice. There are many educational institutions of homeopathy all over the world. In Canada, there are about 5 main schools. 2 main schools are here in Ontario. As I said, I teach at the Canadian College of Homeopathic Medicine, and my friend and colleague Ina, who I know is online, teaches at what we call the other school, the Ontario Homeopathic College. And both of them are very fine schools. I'd like to talk a little bit about what I've noticed as a professor in terms of students over the years. First off, I think both colleges, let's say even 10 years ago, most of the curriculum was done in class. Okay, so the students would have to physically come to the college for their classes. And as you can, I'm sure you're all aware of this, this has changed. Our classes over a year ago have moved to online. And so that is a challenge for those that teach homeopathy to be able to take their curriculum and deliver it in a way that is engaging for students online. And that's something that I'm sure that Ina and I have talked about. How do we engage students? What can we do online? And there are a variety of things that can be done. I take advantage on the Zoom platform to create Zoom rooms where students can get together and work on a case, for example, or work on some materia medica. This allows them to engage as if they were in class. So there are some things that have been challenges, but now there are some things that are benefits. Because students have access to enrolling in colleges of homeopathy, we are finding, and correct me, Ina, but we are finding we have many more students enrolled in the homeopathic colleges than before. So for example, in about an hour, I have to teach. And it is the year one program. And 10 years ago, I would have probably had about 20 to 25 students in class. But now I have 50 to 60 students in class. And they're not just from Canada. I have a student from Abu Dhabi. I have many students from the United States. So this has opened, I guess, the door. And I'm sure many other colleges, homeopathic schools and colleges have experienced this. I don't know if this is good or bad. The students still get the kind of curriculum that has been designed. The feedback I get from the students is they're very happy with the information and the classes. And from speaking to them, I do think that they are still learning at a very high level. So I just wanted to talk about that a bit. And the curriculum in our two colleges, is good Hahnemannian homeopathy, and this is so important to maintain so that we do not dilute homeopathy into polypharmacy, into combination remedies. I'm not saying those don't have their place, but I'm still very proud and honored to be teaching Hahnemannian homeopathy here in Ontario. So what do our graduates do after they graduate from the colleges? Well, many go into their own clinical practice. Some live, very far away from Toronto in smaller towns, and it's nice to see that they are practicing homeopathy. I have one student lives in a city with only 1,000 people, and yet this graduate is a primary healthcare provider in that city. This is wonderful to see. Other students combine homeopathy with another modality. I have some graduates who are also massage therapists or Reiki masters or holistic nutritionists, and they combine homeopathy. Some go into researching homeopathy. And that is so important for us to maintain. We need to continue our research in homeopathy. It is so important as public awareness and education to demonstrate our research projects in homeopathy. And some graduates have opened up what we call retail health stores or health food stores, where they sell homeopathic products, and they are knowledgeable. So when people come in and ask for something for an acute, they will be able to help them. And so some of the graduates have gone on to do that. So how does homeopathy fit into healthcare in Canada? Well, there are challenges. Allopathy is still most recognized in this country. And so there needs to be much education for people to understand and embrace homeopathy. And when I have the opportunity just to speak with people that are interested in homeopathy, I'm not asking them to come and be a patient. They're just curious. I take the time to speak about homeopathy. I give them my story. I tell them about my daughter. I tell them about the benefits. And People still need a lot of that. Allopathic medications suppress, and there are overprescribed allopathic medications given for all groups, and this is still a challenge because tapering off allopathic medication for homeopathic patients who may not completely understand homeopathy when they first start on that journey takes time, takes education, and takes much discussion. But it's worth it. It's absolutely worth it. And those patients that have decided to transition over to homeopathy start to see the benefits. There are opportunities. Whenever there are challenges, there are opportunities. And there is a growing interest in homeopathy and in alternative medicine. Many patients are disappointed with the allopathic system or want to change. And so there is a growing trend for people to try alternative medicine. And maybe they don't try homeopathy first, but the fact that they will try some modality, they will eventually learn about homeopathy. And so in their journey, they will come to homeopathy. I also find, here in Canada, we have a multicultural society. So I have patients, that have emigrated from India, Pakistan, for example, Sri Lanka, and I will get a call in the clinic and they want to see a homeopath. And they come and see me and I go, "How did you find out about me?" And they go, "Oh, well, back in my country, we just do homeopathy. So you live close to me. I want homeopathy." And I go, "Okay, that's so wonderful." So this multicultural society allows for more acceptance of homeopathy. And then those patients that are satisfied with homeopathic treatment refer. And they spread the news and they spread the awareness of homeopathy to their friends. And that is a wonderful thing to see. So we have, on this auspicious day, this celebratory day of homeopathy, over 200 years of history, homeopathy brings a comprehensive system of medicine to us. And, we must continue to practice and we must continue to share our passion for homeopathy with others. And I thank you again for the opportunity to speak, the opportunity to bring this forum together. Thank you very much.
It went off and hello.
Hello, I'm just wondering if there's any questions.
Just
1 minute, 2 minutes.
take your time.
Dr. Lisa, I think you have explained everything nicely.
Good.
And it helped us to know about the origin, development, and history of homeopathy in Canada. Also, it is interesting to know these things from this part of the world.
Mhm.
Although we are much ahead of your country in the field of
Yes.
homeopathy.
Absolutely.
Still there is a long way to go. And
I agree.
we hope that Canada will follow us.
Absolutely.
And basically, to develop homeopathy in any part of the world, what we need is good practitioners. The practitioners who can make changes and make a good opinion about homeopathy in the grassroots level. And for that, what we need is good education. And I think you are all on that level now, providing a platform to study homeopathy in a proper manner, and that too in a classical Hahnemannian way, so that in future, Canada will have good practitioners. And through the good practitioners, homeopathy will be more established in Canada, more recognized in Canada, and we can see the beginning of it. And we have hope on people like you who can build up that homeopathy in Canada also. Thank you for coming over to our forum. And I hope that in future also, you will be coming to our forum to explain and to disseminate the knowledge which you have from the practice of homeopathy, and also to share your experiences. And thank you for your excellent presentation. And thank you very much. See you again.
Okay. Thank you, Dr. Jose. Thank you, everyone.